If your recent trip to the pharmacy felt more like a wild goose chase than a simple errand, you're definitely not alone. Across the country, people are finding that what used to be a straightforward process, getting a COVID vaccine, has turned into a confusing, sometimes frustrating ordeal. You might be wondering if you're the only one running into empty shelves, long lines, or pharmacy staff who seem just as confused as you are. But rest assured, you're not crazy. You're just trying to get a vaccine in 2025, and the rules have changed in a big way. Pharmacies, policies, and prescriptions, let's untangle the chaos together. The landscape for COVID vaccines has shifted dramatically, and it's left both patients and healthcare workers scrambling to keep up. Here's the deal. In August 2025, the CDC and FDA made sweeping changes to how COVID vaccines are distributed and who can get them. These changes were announced with little warning, catching many off guard, including the big pharmacy chains and even some doctors. Now, major pharmacy chains like CVS and Walgreens are scrambling to adjust their policies and procedures. Some locations are overwhelmed, while others have temporarily stopped offering vaccines altogether as they try to figure out the new rules. The FDA's latest guidance is clear on one thing. COVID vaccines are now reserved for people 65 and older, or for those with certain health conditions that put them at higher risk. This is a big shift from previous years, when vaccines were widely available to almost everyone. If you have a chronic illness, a weakened immune system, or other qualifying health issues, you're still eligible. But for the average healthy adult under 65, the door to easy vaccine access has been slammed shut. For everyone else, sorry, no shot, literally. And if you think that's the end of the story, it actually gets even messier. The new rules have created a patchwork of policies that vary not just by state, but sometimes even by county or city. In some states, you now need a doctor's prescription just to get vaccinated, even if you meet the age or health requirements. This means extra appointments, more paperwork, and longer wait times for everyone involved. In other states, CVS and Walgreens have hit pause on all COVID vaccinations, no shots available at all, even for those who qualify. This has left many people, especially seniors, feeling abandoned and anxious about their health. And to make matters worse, these rules can change overnight. One day you might be eligible, the next day you're not. Pharmacies are struggling to keep up with the latest updates, and patients are left in the dark, unsure of what to expect. So why all the confusion? It turns out a major shakeup at the CDC led to staff walkouts and the replacement of the Vaccine Advisory Panel. This internal turmoil has made it even harder for clear, consistent guidance to reach the public. Now, no one's quite sure who's in charge, and pharmacies are left in limbo. Pharmacists are spending hours on the phone with insurance companies and health departments, trying to get answers for their patients, and often coming up empty-handed. Meanwhile, frustrated patients, especially seniors and folks with weak immune systems, are stuck in long lines, sometimes waiting for hours only to be told they don't qualify or that the pharmacy is out of stock. For those who need the vaccine most, the process has become a stressful guessing game, and if you do manage to get a shot, you might be hit with an unexpected bill. Insurance companies are struggling to keep up with the changing policies, and some patients are being told they have to pay out of pocket, sometimes hundreds of dollars, just to get protected. So, what can you do to avoid the chaos? Before you head out, check your local pharmacy's website for the latest rules and availability. Many pharmacies are updating their sites daily with new information about who qualifies, what paperwork you'll need, and whether vaccines are in stock. And don't forget to talk to your doctor. They can help you figure out if you're eligible, write a prescription if needed, and even suggest alternative locations if your usual pharmacy isn't offering vaccines right now. Staying informed is your best defense. Sign up for health updates from your local health department, follow trusted news sources, and keep an eye on your pharmacy's alerts. The situation is changing fast, and being proactive can save you time, money, and frustration. Want more no-nonsense health updates and tips to help you navigate the ever-changing world of healthcare? Hit that subscribe button and stay ahead of the chaos. We'll keep you informed so you can focus on what matters most, your health and peace of mind.